Hey guys, gossip and reactions Maristic. Emergency room nurse lost to S called U.S. healthcare system her abuser and hunting letter. Again, you guys know YouTube have a certain words that you cannot use. If you know anybody or yourself thinking of harming yourself, please seek help, because at the end of the day, it's not worth it erasing yourself. Tristan, a 28-year-old Hawaii nurse, wrote a scathing letter to her abuser 5 months ahead of her August 2023 S. The letter has since gone viral among nurses across the country, many of whom shared Tristan opinion with the U.S. healthcare system. I so desperately want to continue to help people, but I cannot stay in this abusive relationship with Tristan, who worked as an emergency room nurse in Dayton, Hawaii. Her father, Warren Smith, discovered the letter titled "A Letter to My Abuser" on the nurse's laptop 2 months after her death. In October, it was published as a letter to the editor and the Oakwood Register, to a local paper in Ohio, in an effort to raise awareness of how some nurses feel the system they serve is failing them. Smith, the youngest of 6 children in her family, battled depression, but reportedly never sought professional help. Those in the healthcare field may avoid talking about their mental health struggles for fear of jeopardizing their licensure and negatively impacting their ability to continue serving in their current roles. Dr. Lamar Bassi, a psychiatrist in private practice in New York City, told Fox News Digital in comments about the case and its wider ramifications. It is vital to the survival of the healthcare field for workers to feel safe asking for help, and for help to be readily available to meet their needs before their mental health struggles rise to the level of S. She added, "We cannot continue to expect healthcare workers to suffer in silence when they are at risk for a tragic yet preventable cause of death." In his own letter in the Oakwood Register, Smith's father wrote that he now has regretful hindsight for not seeing the sign that his daughter was not okay. She showed her beloved dog, Calypso, with more dog enrichment toys and contraptions than a single pet store sells, her father wrote. Smith had also posted affirmation and mantras throughout her home. She tried so hard to stay alive, but none of it was enough to stop the darkness, her father said in the letter. "We nurses and doctors entered our professions with the noblest of ambition to help others who are hurting." Dr. Michael Sechrist, a wellness expert and chief of the Division of Hematology of Sylvester Cancer Center at the University of Miami, told Fox News Digital, "It's difficult to do that when you hurt more than your patients do." He went on, "When this happened, people leave medicine or worse." In her letter, Smith stated that a shortage of nurses made her feel overwhelmed. "Each day you ask me to do more with less," she wrote. "That is so true. I feel your pain." In a statement to Fox News Digital, the American Nurse Association, ANA headquarters in Maryland said that the negative emotions, mental health challenges, and burned out nurses are facing are symptomatic of a broken healthcare system that too often fails to provide nurses with continuous support and to address chronic work environment challenges. Recently, over 75,000 unionized Kaiser permanent employees across 6 states, many of whom were frontlines support staff, staged the latest walkout of healthcare workers in U.S. history over concerns of staff shortage. You see, the problem with those people that are in charge, they feel like just because you get the job done, there is no need for them to hire more people. There is no need for them to bring more bodies because one person can do 2-3 jobs. I have experienced it. It's not fair. It's not right. You are tired. You are exhausted. You are overwhelmed. And whoever created the 12-hour shift, apparently they were not the one that were going to do 12 hours. That's why they make it legal, because this is a killer. This is exhausting. To do 3 days back to back, 12 hours, especially if you work at nighttime, you cannot sleep. Oh my God. What nurses have to do to earn a living, what any workers have to do to sacrifice your own life to make a living, it's not fair. It's not right, because to tell you the truth, you don't even make the money you're supposed to be making. You're doing 2-3 people's job. You are exhausted at the end of the day. You're driving with your eyes closed sometimes. It's not recommended, but it happens. You have to pull over to take a nap. It's so hard, y'all. It is so hard. And at the end of the day, you're not even getting a thank you from your bosses. You're not even getting a good job from your bosses, because does it matter to them? No. You get the job done. You get paid for it. In their opinion, in their mind, that's what matters. And something needs to change. National data about the state of nurses' mental health and well-being indicates that they are suffering mental anguish or toxic emotions and combating stigma as a healthcare professional seeking help. The ANA added. Smith's letter also referenced that many nurses feel that hospital administrators are taking advantage of them. It's exactly what I just said. They don't care. They just want the job to be done. And if it get done one night by you because they were short, somehow they are expected it to be done many nights to come, or months to come, or years to come, until you get so exhausted you said, this is it. I'm not taking this anymore. You don't appreciate me. You don't pay me right. And I'm working for 2-3 bodies. It's not right. It's not fair. And the craziest part, the newest employee that come in making more money than the one that was there. You make that make sense. Please make that make sense, y'all. You are going to train those people on how to do the job, how to get the job done. But somehow, because of cost of living, COLA pay, cost of increase of living, they are making more money than you. Please tell me how that makes sense. It hurts like a you know what, but somehow if this is all you have to pay your bills to keep afloat, you have to go with the flow. You gotta go with it, because you don't want to end up being under the bridge. You need to make a living, but to be able to train somebody to do the job and they making more money than you, that don't make no damn sense to me, if you ask me. You are a narcissist, she wrote. You use and exploit us to line your pockets using the common citizens' money for overpriced health care. She called for more workplace safety and for nurses to not receive blame for being assaulted on the job. Oh, Lord. I remember the first time I heard about nurses getting hit, she wrote. I remember that you asked them what they've done or didn't do to prevent it from happening. A recent report from the Centers for Disease Control and Prevention, CDC, found that the number of healthcare practitioners experiencing workplace harassment, such as threats, bullying or verbal abuse from patients and co-workers doubled between 2018 and 2022, leading to more anxiety, depression, and burnout. I think they are speaking for me. I'm going through that and more. Seriously, y'all. If I had another way out, I would say this is it for me. You go to work every day, you do the best you can, you supposedly the best worker they have, but somehow have no respect for you. Somehow the co-workers are saying things you never thought you would be hearing, and they team up on you to disrespect you, to verbally abuse you, and it's not fair, but it's happening. Believe it or not, it is happening in the workplace. You are being abused by your co-workers, you are being disrespected by your co-workers, and somehow you got to put your head down, act like you don't hear the verbal abusive, act like you don't see what they're doing. But I've lived through it. I have moments I don't want to go back. I have moments I feel like, God damn it, what am I doing? I've been in the parking lot, don't want to go in. But when you are a responsible adult, when you have bills to pay, you have kids to support, you say, man, F it, cover your nose, take the crap and go in and get the job done. But I have been through it all. Studies show that healthcare workers are at a higher risk for suicidal than the workers in other fields. Bazitor, Fox News Digital, and ICY. Again, it's painful to be bullied by your co-workers, to be verbally bullied and abusive by your co-workers, and somehow you got to take it because you feel like there was no other way out. It happens. I feel your pain. It is unfortunate she ended up that way. I wish she would seek for help. And that's why there was a lot of call-outs. Why do you want to be in a place where you're not appreciated, where you were being bullied verbally, where people are teaming up against you to abuse you verbally? You don't want to be there. Seriously, yeah. You don't want to be there. But at the same time, you're realizing that, okay, you have bills to take care of. You have kids to support. You got to take the crap. And that's why I am one of them that have been abused verbally on a daily basis. But I have no other choice right now. Seriously, I have no other choice. But I feel the pain for this nurse and many other nurses that are going through it. Together, there will be an end. Together, things gonna get better. If you feel like you need help, get some help. I talk to my kids. I know they need me. I have to be here for them. But sometimes it could be tough. It could be tough getting ready to go to work knowing that it's every day the same thing over and over. It's not gonna get better. In my situation, I hope crypto explode. I get my money out and say thank you, but no thanks. The abusive is too much. The verbal abusive that I have to go through on a daily basis, not getting paid what you're supposed to be getting paid, it's not right. Subscribe, yeah. Bye.